heard about all these great uh, new medical treatments that they're coming up with for all kinds of things? Yeah, okay, what are you thinking of? Well, they're not all medical treatments. Some of them are products, but like so you don't have to smoke cigarettes anymore. You can do vaping. Okay, and like we've got these new drugs for weight loss that are helping folks like completely lose weight and everything. That they're like brand new, and the companies putting them out are making billions off of them. They're that popular. Yeah, I've heard of this, and we've got hormonal therapies and stuff that we're using on kids that want to change their gender and stuff like that, and adults. Is like all this stuff. Yeah, okay. What you're saying that's great? Well, I'm saying look at the medical advancement that we've made. Okay, um, I guess the question that I have is how much research have we done into the long term effects of all of these things? The long term effects of vaping, hormonal therapies, various meds, and so forth? Yeah, exactly. Well, I would assume that the pharmaceutical companies have spent lots of time and money on making sure that these things are okay. Well, that would be an interesting and hopeful assumption, but do you think they've done studies across 10 or 20 or 30 years to see what the long lasting effects are? You mean like for vaping? Yeah, like for vaping, for example, or for this new weight loss drug. No, I can't imagine that they've done it for that many years. That would be very expensive. Exactly, and there were like other drugs um, like fen was a big weight loss drug in the 90s. That was also really popular until they discovered after a while that it actually had some horrible side effects and they needed to immediately withdraw it from the market and it never came back. Uh huh. Yeah, and there's been a bunch of drugs that have gone out that there hasn't been really long testing. I mean, even the COVID 19 vaccine. We didn't get to test that for 10 or 20 years before we could say, oh yeah, there's definitely no side effects. So what? Now you're going to be like an anti-vaxxer too, or something like that? No, no. I think my point isn't that we can't do these experiments because we've done these experiments forever, and it's kind of a thing that humans do. They give something a try and then they see how it goes, and sometimes that goes well and sometimes not so well, and some people suffer and some people don't. Hopefully few people suffer and more people get benefits. Okay, so what's the problem that you're here describing? Well, my concern is that we don't tell people that there's actually a lot of room for unknown. Meaning? Yeah, that we just don't know. Folks can try these things, they just shouldn't assume that there isn't a risk. Huh. Yeah, for example, um, obviously smoking cigarettes turned out to be bad for humans. So I've heard. Yeah, but at first, they didn't realize that, and they said, "Oh, use it as a weight loss thing, and everybody should smoke." And they actually had ads in the U.S. where doctors went on and said, "I'm a doctor, and this is my favorite brand of cigarettes." You, yeah, I guess I have seen those. Exactly, and then eventually they discovered, oh, well, I guess there's some parts of smoking that cause bad things for humans, and so then they came up with filters. Right, the filters, and they kept going, and people said, well, we should stop smoking, and banned ads and so forth. Right, and then they came up with vaping, but did they test vaping for 10, 20 years to see what the effects were going to be first? No, they did not. Exactly. And the problem with that is, I mean, vaping is it certainly looks like it doesn't have the bad things that cigarettes had. So isn't that an improvement? Well, that's probably an improvement, and that's fine for people who want to smoke and get to nicotine to do what they want with their bodies. It just should be very clear to everybody that there are some unknowns, and they're pretty big unknowns, and you will be part of the guinea pigs to see how that works out. So you're saying there should be maybe, yeah, more honesty up front that these things are not as well tested as we think they are. All right. Because we don't actually know as much as we keep saying we do. And science doesn't know that much either. The placebo effect being a really good example. The placebo? Yeah, we'll talk about this some other time. All right. Bye.